Hello, friends. Good morning. It's a pleasure to present an amazing group of speakers, literally from all over the world, to talk about how we can improve health of our communities using optimal diet. We have medical students. We have one of my students who's 80 years of age, and we have SIDDHA doctors who bring 5,000 years tradition and medicine from southern part of India, who will share their thoughts along with our exercise physiology and dietetics clinicians here at MU and our VA hospital. Since we are starting and trying to get through plenty of presenters, I'm going to request everyone to stick to time. Although we started late, I really apologize. First, we'll introduce Kiruba Krishnaswamy, who's our Sustainable Food Systems Engineer here at MU, to share her insights about how people are coping with hidden hunger and what her solutions are for us to move forward. Thanks, Kiruba.
Thank you, Dr. Chakkalingam. And so thanks for coming here, and it's a pleasure to meet everyone. I'm Kiruba Krishnaswamy. I'm an assistant professor at the University of Missouri, and I have joint appointment. I'm in two colleges, one in biomedical, biological, chemical engineering, that's in the College of Engineering, as well as in the Food, Nutrition, and Exercise Sciences Division, that's in CAFNA. So the area of my research is at the intersection of food and engineering. So before I go into talk about hidden hunger, before I go and talk about hidden hunger, I would like to talk about chronic hunger. So
the audience see you, they are seeing us and that's fine. Go ahead. Go ahead.
So the audience in the Zoom, could you see the slides, or is it legible? Okay. So to continue the discussion about chronic hunger affects more than 821 million people. And this is before the onset of COVID. And the statistics have increased since then. And this is a condition where 1 in 9 person on this planet is experiencing chronic hunger. That is, availability of food is very less for a prolonged period of time. And also what happened in COVID is, it has exposed the social disparities in the world, like affecting the vulnerable population groups. And so that is chronic hunger. And it is in the 21st century, we shouldn't be talking about chronic hunger, but unfortunately we are. And here I am to talk about something much more dangerous, which is called the hidden hunger. And we don't talk about it because there's less awareness about this. And this affects more than 2 billion people on this planet. It's due to micronutrient deficiencies like iron, zinc, and so on. And around 7 million children before they reach their 5th birthday die annually because of malnutrition. And that number has increased drastically during the past 5 years. And the State of Food and Nutrition Security report has given alarming signs that if we don't address this, it's going to be a very big problem in the future. How is that? Is because in 2020, we had a series of Lancet report describing about the double burden of malnutrition. So what is this double burden of malnutrition? Before, researchers were grouping like studies on undernutrition and malnutrition in one silo and obesity and overweight in other silos. But now people are coming together to discuss how these are interconnected. So just an overview of this particular graph, like image. So here you can see, this is the intergenerational cycle for undernutrition. And this is due to inadequate diets, like, energy inadequate diets. And that is on one side of the cycle. On the other side, we have the intergenerational cycle of overweight that is due to nutrition, energy dense diets. And when you do these systematic studies, and we find common linking factor is a micronutrient deficiency. That is one of the factors that is connecting to these two things. So I highly recommend people going through this series on the double burden of malnutrition. And there are sequence of health challenges that are interconnected, and it's complex. So to summarize that complex image, what I could say is this: is what we have. One side, wasting and stunting, that is due to the undernutritional aspect. On the other hand, we have overweight and obesity, that is due to the energy dense diets. But all these things fall under the same umbrella, and this is what we call the double burden of malnutrition. And increasingly throughout the world, we can see this: communities that has less access to healthy foods are also experiencing overweight and obesity. And a key linking factor that has been said is micronutrient deficiencies, and it affects around 2 billion people. So why am I interested about that? Is because on one hand, I have a research program here. It's called the Feast Lab. And one hand, we have this hidden hunger and the double burden of malnutrition. But on the other hand, we waste around 1.3 billion tons of edible food. That's a big challenge. So in nature, there is nothing called waste. Waste is a terminology that's created by human beings, right? In nature, everything transformed into something useful. So if we can learn the processes from nature, then we will not be calling it as waste, but rather raw materials for processing. Because all these foods that go as waste has high amount of nutrients like vitamins, minerals. And if we know the technology to recover them and develop foods, then we could address these problems. And so that's the whole idea of how do we address these two challenges together. And I do know it's a complex challenge. There is no single bullet to solve this problem. And everyone is contributing towards it. So how we are contributing in our side is like the Feast Lab. We have 3 areas of research. One is sustainable food systems engineering, where we do upcycling of food waste and food loss. That is, we prevent food waste and food loss first, if possible. If not, we will recover micronutrients and bioactive compounds from this, and try to develop technologies like microencapsulation, nanoencapsulation technologies to protect these bioactive compounds. And then we can fortify them back into food. So that way we are creating a circular economy, recovering and feeding back into the food system. And the interested population groups are women and children in urban, rural, and tribal communities. As I said, it's a complex challenge. There is no single bullet to solve this, but everyone can contribute. And so here, that's my team. And if you're interested, feel free to contact us. And that's our contact information. And I'm ready to take questions.
Same individual have malnutrition, wasting, and obesity at the same time. Usually it can be in the same family, but it cannot be in the same individual.
Yes, a same individual can have. They can be obese, but they could be deficient of any, folic acid or vitamin, iron or some other micronutrient. And also they might be consuming foods that might not be healthy for them. So it's a complex challenge. That's why we need people from multiple disciplines, from public health to food industry to health systems, everyone working together to solve this problem.
All the global problem of wasting of so many billions of food, why not to pass the order that no one should waste hereafter?
It is not individual waste. like companies?
No, everyone. There is no question about you are saying waste is made by human being. When is the dictum that so many people know for? Why want to waste it? That if you are going to inculcate in the brain of everyone, the question will never come in. Because the moment I know is the recycle full giving that one, I will be reluctant to take it. But once you don't waste it, you'll be going to that. If they want, let them take. Let them not waste. That's what I'm saying. It's not practical one. What it happens, you are giving a solution of how you can recycle the food or wasted one, giving it as capsule form. But I don't know really.
So
I really don't know.
the question is, food waste, there are two concepts here. Food waste is happening and food loss. Food loss happens on the farm, in the production, in the processing, and until it comes to the retail. Food waste happens from the retail to the consumer at home and then. So we need two different strategies to address this. And when you're talking about food loss, like, you can see tons of tomatoes in a field that's getting wasted. So how do you recover that? Because it does have
One
micronutrients.
small question is the food loss in the farm is going to be a rotten one, because where you have to discard it. Is it that one also can be recycled for this micronutrient?
Yes, that's what we are working on.
Oh, then fine.
Yeah.
Then
So
fine.
Thank you.
Thanks so much. Thanks so much, Kiruba. We have a very, very special guest, Marilyn, who is going to talk to us about her experience of hunger is good and why she claims that is to be true. I'm going to introduce her to you, please.
Hi, distinguished audience and Dr. Nanchakalingam's parents. I'm so glad to meet you. I took an OSHA course with Dr. Chakalingam, and it was on higher consciousness. And that was the purpose of my taking the course. He talked about hunger and how it could be useful to you. And we're not talking about chronic hunger, this dangerous and awful problem that we have worldwide. We're talking about individual hunger, using it. Can I move a little bit? Oh, I can't move very far then. And I was skeptical. I mean, but I learned from him things. He reinforced things I already knew. I've always smiled at people when I meet them. I feel that smiling can change a person's day. You can smile at them and they'll smile back and feel better, or you can frown and they'll feel bad. So that was something that was reinforced. But I didn't know that you could smile and make yourself feel better, which I learned that you can smile at home several times a day and make yourself feel better. I don't know the brain chemistry, but I know it works. Still, the hunger thing was an issue with me. And I had been trying I knew that if you had a longer period of time between your last meal and your breakfast, that was good and it helped you lose weight. But what Dr. Anand told me and told the class was that if you could just, when you feel hungry at first, just wait 15 minutes, wait half an hour, wait 45 minutes, wait an hour, and you'll have ketones that affect your metabolism and it helps you to lose weight and you'll feel better. I already knew that if I ate too much, I didn't feel good. But I started working on this hunger and I got to where I would start to be hungry and I'd say, well, you could wait a little longer. And I would wait a little longer. I finally worked up to being able to work an hour. Now I'm a writer, so when I'm writing, I can go for 2 or 3 hours hungry. But this is specific thing that I do. And I have lost 40 pounds. I'm 80 years old. I can do so many more things than I used to be able to do. And I have, I've been dieting. I have a program that gives me things that are easy to fix, and I don't have any waste, which is wonderful because the meals are just for one person. And so that's something that I didn't like about my lifestyle, was that I would end up wasting more food. And the other thing is that when I feel satisfied, I may want more because it's delicious, but I stop eating as soon as I am no longer hungry. And I've been on diets all my life. I weighed 11 pounds and 4 ounces when I was born. And I've been heavier than normal my entire life. And once I was out to dinner with my daughter and I was trying to find things that I could eat, I wasn't being obnoxious. I was just trying to find things to eat. And she said, Mom, I have seen you on diet after diet after diet, but I have never seen you happy about it. So Dr. Anand Chakalingam's course has been such a blessing to me, as he is. Thank you, parents, for having him.
A small comment, you stay back here for a minute.
Okay.
If I assess your age as a cardiologist, I am Anand Chakalingam's father. I can give your age only 50 years today now.
Oh.
And I saw you from the time when you were entering in. I never seen you except smiling. How were you were before that coming to Osho one? You have been worrying about things, or this hunger made you to laugh or smile all the time? He says smile 20 times an hour. You are smiling 20 times per second. You are seeing you all the time. You made it smiling. I think the smiling made it much better as a vicious cycle. Is hunger made you to smile like that, or you change the attitude?
Well, I've always smiled when I meet people. It's kind of an automatic thing with me, but
That when you are expressing also you are smiling. I never seen a people like that. You made your life and existence a smiling one. Then we will celebrate your 100th birthday. I will come back here on 110 years of your birthday year. I want to wish you.
oh, thank you.
Thank you.
Thank you very much.
So how old do you feel now?
Oh, in my mind, I'm in my 30s, but but in my feeling physically, I just went from 65 to 60 because I walked up here on my own. That's the farthest I've walked in the last 15 years.
When you Madeleine, communicate the message what you are now enjoying. At the earliest time to your friends, relatives, everyone spread the message. Chokalingam and we self cannot do that. As the individual, what you are experiencing, your communication is much more effective than what myself, Anand, is saying. I really appreciate. You got enormous work for the society. Be committed to that.
Well, thank you. It's an honor to be here.
After starting this hunger gratitude, is your happiness gone up in a scale of 1 to 10?
Oh, yes. You know, I don't think anybody, it's kind of hard to be at a 10. I live alone. I'm 80 and a half, but I have my own little house that I recently bought. But I'd say I'm at about an 8 or an 8.5. So I guess that's, if you compare it with 80 and a half, that's not bad.
And small comment for both of you. He said 1 to 10. What I assess for you is 20. The scale is more than 10. You are in 20 now.
Oh, thank you. Well, Dr. Chakalingam is inspiring.
Thanks so much for coming.
You're welcome.
Thank you. Thanks so much, Marilyn. I'm wondering if my research collaborator, Dr. Jill Kennelly is able to address us for a little bit on Zoom. She might not be here. I'm not sure. Okay, she might have left already. She is my collaborator in exercise physiology and nutrition. Next, we will go on to Neeraj, who is, I think, the only neurologist and neurocritical care intensivist in the world who is doing research on ketogenic diet, trying to tell us how that might help brain injury patients recover from very challenging situation. Thanks so much, Neeraj, for doing the work you're doing and finding the time to be here with us today.
Thank you, Dr. Chaklingam, for inviting me. I am Neeraj. I am one of the neurointensivists at University of Missouri Hospital. Am I audible? It's good? Okay, good. So when Dr. Chaklingam invited me, I thought, okay, I'm just going to be a silent person. I might not say anything, but then he just put me in the agenda for 15 minutes. Then I prepared the slides for 10 minutes and he gave me 10 minutes. So I will be just overviewing some of my research that I'm doing here at the University of Missouri Hospital. And there's a wealth of literature about traumatic brain injury, how that affects the humans, but nobody has done anything like how can we improve their lives? How can we make sure that in the acute setting, like we can help them heal the brain really fast. So that is what this talk is based on my experience. So as we all know, that traumatic brain injury is the major cause of death and disability in young adults due to different causes, either blunt trauma or penetrating trauma or from motor vehicle accident, you name it. And it carries a very high burden of economic burden as well as social burden. And in the ICU, in the neuro ICU, what we have to deal with is the patients who come with a GCS of score of 3. GCS is just a coma severity score. So 3 means they are comatose condition, not responding at all. And those patients have really very, very high mortality and very poor survivability. So in those patients, I decided to do something to help them. There's an immense need anyways to develop new strategies. So if you think about this pathophysiology just in one slide, which I'll summarize, that as soon as there is an injury, which is called primary injury, either due to trauma or accident, the effect of that is vast. If it is very severe, yes, we understand that it's going to be terrible outcome. But what causes other problem is the secondary injury, means the consequences of that primary injury, which is either inflammation, the swelling that happens, the excitotoxicity that happens, the seizures that develop in those patients, and then the patient remains in comatose condition for a long, long time. So in order to help mitigate some of these problems, are we able to see?
Yeah, we can.
I did share. Okay. Perfect. That's good. Oh yeah, thank you.
Go back.
Yes.
So
So during the secondary injury is the one which is an important issue in the ICU when we take care of the patients, and those patients does not even wake up at all. So the strategies that we do is like sometimes we just give them medications to decrease the swelling. They could have surgery. And most of the time, we just keep them in a completely comatose condition for 10 days, 15 days, thinking that after removing the sedation, they will get back better. But other than that, there is nothing much to do for them, just controlling their hemodynamics. So if we have some kind of an intervention, that would be really useful. So I found that using the ketogenic diet, ketogenic diet traditionally, as we know, it's a high fat, like almost 70 to 80% is fat with very low carbs, like 5 to 10, and then some moderate protein. So it has been used in seizures with excellent benefits. We know that. But the question was, can this be used for traumatic brain injury and why? So I decided to put my perspective into this, and we did a study. The rationale for this study was that glucose as a fuel cannot be used by the brain when it is injured. So the glucose transporter system is shut down. And we keep feeding the patients with the regular feeds. So in the ICU, we usually use the tube feeds. And in the outpatient setting, they can be on the ketogenic diet or regular diet. But my main focus is in the ICU. So I use like tube feeds, which we have it currently. They contain very high amount of carbohydrates, like almost 250 ml contains about 30 to 40 grams of sugar. And like fat is around 5 to 8 grams. And the protein is about 10 to 15 grams. In comparison to the ketogenic feeds that have like 70% from the fat, 10% from the carbohydrates, and 20% from your proteins. So we decided to do a study with that formulation that we got it. And we found that there could be some additional advantages to it. So another rationale study was that when there is an acute brain injury, there is a local lactic acidosis. Lactic acidosis is due to the anaerobic glycolysis. So there is a tissue death is going on. Is there any way to recover that? Like how can we make sure that the cells get enough supply of the ATP, which is the main source of the energy? So instead of using the glucose, if we use ketones as the source of energy, they could bypass the blood-brain barrier, enter into the Krebs cycles, generate the ATP. So that is the main crux of this theory. Similar things, if you think about as the hunger has the same effects. It directly acts on the brain, like ketones generate and go into the circulate in the brain and instant energy. Similar things have been used for athletes, sports person. They have now started to use hunger as a strategy to build up the stamina and the endurance. So all these things make sense if we use it properly. So that was the rationale for my study. So based on this, I did this study in which we admitted patients, adult patients, 18 years and older, with a traumatic brain injury, severe traumatic brain injury with GCS of 8. That means they are intubated, sedated, sometimes paralyzed, on sedation and everything. There are a lot of exclusion criteria. These are standard exclusion criteria. We do not want the patient like to be an alcoholic guy with a damaged liver, pancreatitis, and other stuff. So those things are all excluded. If we think that the patient will be terminally ill and they will not survive, we will not admit them. And DKA is a relative exclusion criteria. Basically, if we could treat the DKA and the patient is borderline diabetic, we could still consider, but for the current study, it was an exclusion criteria if they are inactive DKA. Now, I have the list of these 10 patients. Basically, now I included more patients, but I have not uploaded it here. This, all the data was published. So there are like 10 patients, and out of this, you can see that they had like intracerebral hemorrhage, subarachnoid hemorrhage, subdural hemorrhage, like from different reasons. And their GCS was 70, 40, 3T, 11T. So they had very poor GCS. And the MRS is the modified Rankin score. That means it just tells you that how functional they are. These were like almost at the verge of death. 6 is death. So this 5 is like at the verge of death. So these were all the profiles for this patient. So initially, this study was like a feasibility study on these 10 patients. And here I could say that I was able to achieve ketosis. Ketosis is a state where the body metabolizes the ketogenic tube feeds and start producing the ketones with the help of liver. And the ICU is such a dynamic situation that a lot of medications interact. So we have to be really careful to choose the medications. This was for the first time I was doing it. So there will be definitely much lessons that I have learned from this study. So that's why in some of the patients, you can see that there was no ketosis achieved. But most of the patients were able to achieve the ketosis within 1 to 3 days. And the level of the that we measure, the ketones that we measure, the serum beta hydroxybutyrate, that were levels also we measured. More than 0.5 is a good cutoff. For our hospital, it was more than 0.27. So that is what I was going with. Also measuring the length of stay, the adverse effects, where they were at the discharge, where they were disposed of. So most of the patients were able to go to rehab, acute rehab, which is very good for these patients. And then discharge, modified Rankin score. As I mentioned, like 6 is dead, but you can see that 2, 2, 3, 2, that is all good. So, and then at 3 months, the modified Rankin has almost come back to normal. So 6 is dead, 5, 4, 3, 2, 1. So the lower it is, the better it is. So now I'm trying to make this as a bigger study to see whether this is effective. So we try to look into the length of stay in the ICU and the change in the Glasgow coma scale. So we found that yes, it does decreases the change in the GCS is quite significant. The length of stay is decreased. So that means it is effective. Now, this is just my preliminary data on this 10 patients, and we are trying to make this as a larger study. So just to wrap up, we are trying now to understand like how does ketogenic diet causes all these changes. So how does that affect the gut microbiome? So that is what one of the collaborative study which we are planning in recent coming months. What is the mechanism of the ketogenic diet to help with acute brain injury? So we are trying to look into some inflammatory markers in the serum as well as in the brain to understand that, and how feasible it is to consider ketogenic diet for long term, because there are a lot of fads about this diet. Now, ketogenic diet, as other diets, come in different flavors. Like some say that you want to consider low carbohydrate, that will be effective. Somebody will say that modified ketogenic diet, Mediterranean diet, that will be effective. So those things needs to be standardized. That is, nobody has studied those things, even though people have started to talk about it. Is taking fats in diet is good, or avoid sugar is good? So that will be $1 million question for the next few years of my research. So, and Kiruba will definitely help me in that. That's all I have to say.
Good presentation, but generally in intensive care, whenever you see a coma patient like that, general instructions throughout a lifeline, give them glucose as intravenous one. I think it should be stopped. If you're going to the infusion, the glucose must be dangerous to human. Does it really affect them further?
That's correct. So, I mean, in acute brain injuries, these patients were not given glucose at all. Right, all kind of fluids containing glucose, like dextrose normal, definitely we don't give it. Even you can say that any situation in which they had to be given dextrose because of low blood glucose, it was given just one time.
Another small question. You said traumatic brain injury. We want to put trauma, brain, and then injury once again, trauma. Is there any way we can find it better name? I was asking you.
That's an awesome question.
There can be ischemic injury, there can be other injuries too.
It is physical trauma related injury. Patient must have fallen down, right? That's the usual reason. It's not stroke patients, right? Or is it stroke also?
No, this is only trauma. Trauma is defined
What
as.
I want to know is trauma, brain. Once again, bring in injury.
Yeah, so traumatic brain. So I mean, that's how you can consider the traumatic brain. Injury is something just to make it
Inside
simple.
the brain by trauma. That is to communicate. Fine. Maybe better terminology we find out. I'll get that one before I leave possible. Thank you.
I thought I'll go in fast for a few minutes just to introduce some of the concepts that we are doing. Thanks so much, Neeraj, for what you discussed, and because he is helping us with how we can use the same learning and exploration that he is doing in brain injury towards heart failure and heart injury patients. Yesterday, I met a patient with ejection fraction of 25%. She's done everything that's guideline recommended, but she wants to know what else can be done. Her weight is completely normal. So that's something we are going to start working with to see what all are options available. But in the last 5 years, I want to share what I've learned in heart failure settings. Now, in the VA system, our program is taken up by several flagships VAs in Texas, Florida, Boston, California, where different departments are trying to incorporate our Heartful Living 8-week course. So what it is one of the samples I'm showing you here, a person who went without any food for 50 days at the time of being diagnosed with coronary artery disease, 2 vessels which were critically occluded. The CT surgeon gave him the appointment to have heart surgery next morning. He said he had attended our 8-week mindfulness, cardiac wellness course that Marilyn was just talking about, but she attended only the SIDDHA consciousness, whereas here we do the 8-week cardiac wellness course. And after that, he wanted to give it a shot before going for surgery. We said, no, we'll do the surgery, then you try it. But he said, no, I want to give this a shot. So he went home and it's a free world. He didn't eat for 50 days. He took himself off 23 medicines. We are not recommending anybody to do this. That is the reason it's published. But also we want to share with the world what we are learning about natural ketosis, because you just heard from Dr. Arora how much challenges he has in inducing ketosis through diet. He has to give very high content of fat, whereas many of our patients are getting into that level of ketosis. Nutritional ketosis is between 0.3 and maybe 3. And it's not toxic when it is 10, 20. That is when we worry about ketoacidosis. So we are showing all the levels here except the ketone levels. You may be wondering why. Because it was before I even realized the value of ketosis that we encountered this patient in 2018. This is a patient that we recently encountered. She is the head nurse in our hospital. And at 64, she presented with new onset leg edema, pulmonary pressures were elevated. And based on her age and her BMI, which both together end up at 99, it's a very simple tool anybody can use to assess for yourself if you are at risk for heart failure due to obesity. We don't do all the sophisticated tests recommended by the European guidelines in all our patients. I told her, you're a nurse here, why don't you try targeting some weight reduction? She said, I don't want gastric bypass surgery and I won't qualify because of my comorbidities. This is what she did. She still lost all the weight within a few months. And this graph needs to be updated. She has lost some more weight now. Her BMI is ideal at 23 currently. She's reporting feeling 20 years younger. She couldn't be here, but Marilyn came up and talked to us about how well you can feel. Marilyn doesn't have a weak heart, whereas my head nurse had a weak heart, but that's cured. She's off all her heart medicines. So this is one of the first cases where we have cured, reversed heart failure with preserved ejection fraction, just with lifestyle. She's come off medicines she has needed for 10 years. She's definitely going to retire next year. Having a 75% mortality in the next 5 years has now changed. Now she can live as healthy anybody else at the age of 65. That's the change that has happened to her because she trusted our cardiometabolic program. This is the heart surgeon who gave the appointment for that patient in 2018 to have heart surgery. Last year, he decided to go after his weight himself. And he has lost 43% of his weight. And he's finding it so much easier to operate on patients, to take care of his work at home. And he's walking and running 15 miles several days of the week. So he's feeling like a 20-year-old. And to prove that, he's wearing the shirt that he last fitted at the age of 20. After that, now for several decades, he has not been able to fit in this. So even doctors don't realize how much stress we are carrying in the form of excess weight. This is a simple graph where I'm comparing myself, AC, I'm 163 pounds, with another person who is in our system, but he weighs 345 pounds. So if you compare my fat in pounds, which is 30 pounds of fat I carry, he carries 156 pounds. The reason I'm sharing this with you is we put ourselves through the same metrics. And what it looks is, if he loses 50% of his weight, he's going to lose 30% muscle, but that is not bad. We haven't tracked Dr. Markley's fat percentage pre and post, but what I'm sharing here is new way of understanding the body. But he's losing 81% of his fat if he gets to lose 51% weight. So disproportionate weight reduction, because the body has its own intuition, so it will lose the extra weight. So this is a patient who has lost 50% of his weight without even seeing me. using digital therapeutics. He understands our program, the 8-week course, everything we delivered online. And from ejection fraction of 25, his heart squeeze is now normal. And he reports like he's feeling 20 years younger. All this is yet unpublished, but we are so excited about the future. Neeraj showed exciting data with ketogenic diet in the ICU setting. But what I'm showing you in the hospital setting is people can enter into ketosis. So this is new in the last couple of months. We've now submitted this data to the NIH to see if we can get funding for our mindful eating program in the hospitalized acute heart failure setting using ancient SIDDHA wisdom. They are here to talk to us also for a few minutes today. This is my most exciting aspect because my wife is a nephrologist dealing with kidney failure. We are showing how acute and chronic kidney disease both respond to our cardiometabolic interventions when patients are able to lose weight. This is again not through gastric bypass surgery. This patient within 2.5 months has lost 24% of his weight. His age is only 27. So all this information, including today's meeting, we will post at highlifejourney.org for anyone to go and access. And we've kept everything free and open, just like Khan Academy. Thanks so much. I invite David to come up and go to the next one. So we may not have much time for question answers. So I'm happy to talk to you at the end of all this. Please, David. David is our medical student who is, I'm so privileged to work with him. You will hear why from him.
I think the honor is all mine, but thank you, Dr. C. I appreciate that. So I am David Spadavecchia. I am a fourth-year medical student, married with 2 kids. I've been doing intermittent fasting for some time, 6 years. Probably at the end of this year is when I'll hit that. I'm up to a 2-hour window or 1 meal a day. It's basically the same thing. But something I want to kind of change into is I was in the military for 8 years, still am technically, but I was active duty. And back in 2012, I went to a school called Sears School. Some of you might have heard of it, but it's a survival, evasion, resistance, and escape school. It's pretty well known in the military and also outside of the military. It's 19 days, and for the last 7 days, you're escaping and evading from fictitious captors. And for the first 4 days of that, you get 0 food. That's 4 days of 0 food. And then at day 4, the end of day 4, you get a small handful of rice. And then you go 3 more days of 0 food, essentially. It's like 2.5. So 6.5 days essentially of just water, drinking out of creeks and that kind of thing. And the military has been doing this program for over 40 years. And but what I really want to hammer home is that while people are, 7 days of no food, essentially, people that already don't have a lot of fat reserves already because they're in the military, they're running through the woods on less than 2 hours of sleep. They're doing all kinds of things, making shelters. And that really the point again is that I want to hammer home is that hunger is not this state of weakness, this state of like being tired or I need food to keep going for my day. Hunger is your state of strength. Hunger is where you get things done. Before I go any further, though, I do want to do a couple caveats. First of all, that was a mandatory starvation. Everything's easier when you're forced to do it, right? So if you don't have food, it's easy to not eat food. And the next point is this is not food insecurity. Okay, this is entirely different. Food insecurity is psychosocial, all kinds of malnutrition issues. This is the first world issue of we have too much food, we eat too much food, and it's taking away from our source of strength, which is hunger. So, obviously the thing we're all trying to tackle is obesity, and we've known about this for many years. It's only getting worse, and we try all kinds of new diets, but roughly 80% of people who are trying all these diets, even the ones that lose weight, so it's already hard to lose the weight, but the ones that lose the weight, 80% of them are not going to maintain that weight loss. And by 5 years, 80% of those people will have gained 80% of the weight back. And then that's only going to make things worse down the road, because now they're going to try fewer and fewer diets in the future, and they're going to give up, right? So we're going to create that mental feedback loop that's going to dig us down deeper instead of the opposite. That's just a pretty graph that shows that, yeah, we're all gaining the weight back when we lose it. So I don't just want to talk about intermittent fasting. I love intermittent fasting. I think it's a great tool. It's another arrow in your quiver, but it's not the be all end all. The important thing is the mental health, right? All these diets, they all come from, us wanting to try things, a source of strength. We have to work on that mental health first. But where is a great place to improve that? And I honestly feel that hunger is the thing that we need to fix. We need to reframe how we see hunger. It's not like, again, this source of weakness. It's not bad. it can be a powerful reminder, like we'll see in the SIDDHA, the gratitude experience. And it's something we can use to help patients sort of remind themselves of how strong they are. And yeah, just it's okay to be hungry, which is something Dr. Chuckalingham told me about 4 or 5 months now, and it's stuck with me ever since. Yeah, a couple more things that I'll just make clear is we're all trying to, fight this sort of American culture of the 3 meals a day, constant grazing, snacks all day. And yeah, we don't eat enough fruits and vegetables. We eat processed foods. These are all things we've heard 100 times before. People aren't going to change that, right? We have to start really small before people start changing things. I still don't eat enough fruits and vegetables, so we've got to start small. We've got to start at the first little baby step. And so anyway, I also want to make one thing clear. An African American woman in the hospital area told me that food is love for her culture. And that is really important. Food does have a lot of really good, powerful things. It brings people together. It's just, again, it's about reframing that relationship with food. And ultimately, I feel like we have this burden of thought that we're constantly like, we've had breakfast, but while we're thinking about breakfast, what are we going to think? What are we eating for lunch? And then when you get to lunch, you're like, what am I eating for dinner? And we don't need this constant thinking. We can use intermittent fasting, and close off a whole portion of our day for eating and say, I'm going to focus on living and family and the things that I want to get done. And I will open the floor for questions quickly. Oh. Yeah, I know, especially, with my own 10-year-old, it's a constant struggle because he loves to graze. He thinks that if he's watching TV, he should be snacking, right? So there's this, and bad parenting, right? So I'll take some of the blame for that one. But I can't at all speak on children and children and pregnancy. Those are 2 different states of life that I wouldn't dare to speak on as a 4th-year medical student, and to how well these things can work. I'll let Dr. Chuckalingham.
Tell us again about how long you don't eat everything. Kind of missed it.
Yeah, I don't get calories, I should say, for 22 hours, right? So I'm still drinking water, black coffee, those kinds of things. And do I think it could be useful for children? Perhaps. I think that if we just simply close down, obviously 2 hours might be too little for children, but if we, said kids should be eating from 8 a.m. to 8 p.m., just 12 hours instead of, constant grazing from when they get up, that kind of thing, or at least, make clear boundaries and stick to the 3 meals a day kind of thing. I guess my whole theory, and with the intermittent fasting, is that constantly putting your body in this fed state is like stopping at a gas station every 5 minutes. You're never going to get to your destination if you don't, actually, doing the driving. And the fed state for me personally keeps me in this sluggish rest and digest mode. It keeps me from doing things, keeps me from being active. It keeps me from exercising. Whereas the fasting state is what gives me, strength and energy and clarity of mind, and really allows me to get stuff done. So I know I kind of veered off of your question for children and that kind of thing. Again, children is one of those things that I know medicine likes to just leave the pediatricians, and I'll do that with that one.
Small comment is what I suggest is, when you're telling about that younger generation, you must appear, one second, you must appear in the TV shows hereafter. You expose what you are telling globally in TV television. Because television all the time propagating the diet, whatever thing, negative one. I think you make a point to appear in the television, people will know that. The most important 2 concepts is not the quantity or quality. Please make that sustain the quality of the food, quantity reduce it. They must be doing very well. So you must be the best person to give that.
One comment as well as a thought. Basically, the children should not be fasted. That concept is incorrect. The reason being, there are, from thousands of years, there are certain cultures like Jainism, Buddhism. They have certain days where even the children are told to fast. Even in Ramadan, children are taught. So if you start it from a younger age, the better it is.
One small question, you said in your slide, above the age of 18 you included. Why not did you include the children one?
I take care of adult patients only.
Oh, in that way, so you were excluded. But my personal feeling, injury of any brain must be included. I think
It can be included. Ketosis has been tried in kids also.
Super. I agree. That's what I want to ask you.
Amazing. Thanks, David, for a very inspiring talk from a medical student. Now we have your slides. You see it here?
Yeah,
It's yours.
it's right there.
Yeah.
Approach number 11.
Yeah. Thanks so much, Kelsey, from our VA, helping us understand how to manage diabetes using nutrition. We'll keep it a little shorter because we are running short of time. Thanks so much.
All right, so today I wanted to talk about an article that summarizes a lot of the research that we have related to using nutrition with diabetes care. And so if you guys want to look at it, it's this link, diabetes care. It's from 2019, but it looks at 345 different really, pretty legit studies. So I just want to look big picture today about what we can really do outpatient wise, because that's my role. I just threw a family pic in here. I have 3 kids under 5, so I'm a mom. I work at the VA, and I have 2 big roles at the VA. So one of them is kind of in that what we recommend for people with prediabetes, which is an intensive lifestyle program, and it's 16 weeks straight. It's group classes over video connect, and it focuses on exercise, food, and goal setting. And then the other half of my job is doing outpatient. So I work in, literally my office is kind of in the waiting room of a primary care clinic. So physicians can put, in a consult, and I provide medical nutrition therapy for people that, may have just been diagnosed with diabetes or maybe further along in the process. But there's research to support both of these things, these intensive lifestyle programs and also medical nutrition therapy. So some of the things that we know is that, did you need to say something? All right. So one thing we know for the intensive lifestyle program is that they can reduce the incidence of type 2 diabetes by 58% over 3 years. And that for medical nutrition therapy, there's a lot of cost savings potential for the hospital and physician services. There's an average of 2% decrease in A1C, and it could be as beneficial as the medications we have available if started towards the beginning of the diagnosis. So there's a lot of benefits to using your dietitians, okay? And it's important for to have lots of touch points with the patient. The more the better, because you can get to know them, where they're coming from, what they need, and what they're willing to do. So as you can see, lots of 16 and 24 weeks that you see someone with those lifestyle programs. And then with medical nutrition therapy, ideally you see them in the first 6 months, 3 to 6 different times if you can. So in this consensus report that I'm reviewing today, it talks about 5 main things for goals for nutrition therapy. And the one being promote healthy eating patterns. So you may be asking, well, what the heck does that mean? Because we don't really know what eating pattern is best. And that's kind of true, because we don't have an ideal percent carbs, protein, and fat that we can recommend for all people with diabetes. And we need to assess their individualized needs, looking at their current eating patterns, right? Their preferences and our goals for them. So I'm going to briefly go over carbs, protein, and fat and what we do know. So carbs, we know that if we reduce them some, it could be beneficial. I mean, that's kind of a given just based on what we know, but we need to look at the timing and look at their activities they're doing, their medications they're taking, the food choices they're currently making. We need to help them know what even has carbohydrates, right? And and as far as fiber, we know that can be very valuable. 14 grams per 1,000 kilograms is recommended. So around, 30 grams or maybe a little less a day. Hopefully through food, so you can get the vitamins, the phytochemicals that are associated with that, and not necessarily just through supplements, but both can be helpful. For glycemic index, I know that's thrown around some. It's not necessarily shown to improve A1C values from the research we have, but it is interesting information, and it could be valuable for learning, but it can be a little bit one additional thing for a patient to learn and figure out, if that makes sense, and it may or may not be as valuable to focus on. Then with protein, we have some studies that show with a little higher protein range, like a meta-analysis from 2013, around 35% protein compared to like 15% makes a greater weight loss of 2 kilograms and a 0.5 greater improvement, 0.5% with A1C. And then a 12-week study also showed some improvements with weight, fasting, glucose, and insulin requirements when we're comparing 30% protein to 15% protein. So there is some benefit to a little more protein sometimes with people. With fat, we know there's benefit for if, especially with refined carbohydrates and stuff, if we're replacing some of those with more fat, there's some demonstrated greater improvements with blood sugars and cardiovascular risk factors. Sorry, I made a mistake. It's supposed to be HDL. I did this PowerPoint a little quick if you can't tell by the lack of color and pictures. But I do think it's important to recognize that we have to watch trans fats, synthetic trans fats. We may need to watch dietary cholesterol. We don't necessarily know. For the general population, we know that it's not as big of a focus, but for people with diabetes, there's correlation with serum cholesterol levels being higher. There's not necessarily more cardiovascular events with higher dietary cholesterol. So we need more research. And then when it comes to eating patterns, like you guys mentioned a little bit, there's a lot of different ones. Mediterranean, I just tried to list a few. They're all on a few different slides, but there's Mediterranean, vegan, vegetarian, low carb, very low carb, low fat, very low carb, very low fat, DASH, which is dietary approach to stop hypertension. Those are some of the main ones we have a lot of research on. And it's hard because there isn't one that is the best. There are definitely benefits to each of these. And as you can see on the side, on the right, you can see the Mediterranean diet, which is lower in red meat, lots of fruits and vegetables and fiber and lower sugar. You can see it reduces A1C, but so does the vegetarian and vegan. And there's a few that can reduce risk of diabetes for those that are in the pre-diabetes range, like Mediterranean, vegan, vegetarian, low fat, DASH. So keep in mind, there's benefits to a lot of these. There are situations with, when someone is really not wanting more medication, it may be a viable option to try the low carb or very low carb eating patterns, which have been mentioned a little bit already today. So what do I do, Kelsey? You're telling me all this stuff, but you're not really giving me anything to go on. Well, this might be something that's helpful. Emphasize non-starchy veggies, minimize added sugars and refined grains, choose whole foods over highly processed foods to the extent possible. That's kind of the nitty gritty of all those eating patterns of what they think is really helpful within them. So we can't just tell people that though. They may be at a really different place to receive that information. They may not have access. They may have certain very different eating habits. So we have to see where they're at and hopefully approach them with compassion and think about their individual needs. So that's what 2 of the 5 goals they talk about within this consensus report are that we need to look at their needs and address pleasure of eating. We need to maintain that. We want to enjoy our food, right? And so looking at the bigger picture, we need to recognize there's a lot of social determinants of health. It's not just weight. I encourage people to turn away from focusing so much on weight within the realm of providing for a healthcare situation, because I think there can be a lot of stigma, especially with type 2 diabetes. We think about it as a lifestyle disease a lot of the time, and we think about how it's larger, people with larger bodies get diabetes, and they eat a lot too much sugar, they get diabetes. I think if we can step back from that and focus on what we have control over, those health promoting behaviors, that can really help someone move through behavior change in a better way without feeling like they're stuck. That can be a tricky environment for having a dynamic conversation about behavioral change when we're focusing too heavily on one thing that we may not really have as much control over. You mentioned, the fact that weight loss is very unsustainable sometimes. And so just kind of thinking about how we're approaching that, using maybe some motivational interviewing, asking the questions for the patient, letting them talk a majority of the time, and hearing where they're coming from and where they might be able to go. So as far as something I'm interested in, it's intuitive eating, and it's developed by dietitians. There's 150 or more studies on it. It's an up and coming thing, and VAs across the country are starting to have classes that focus on this. And it is actually more about diving into your needs and hunger needs. And it's also about, it's not about the scale. It's not, So it's something that might be worth looking into as far as another approach to guide patients through looking at their needs and making changes. So my goal is just to encourage referring to dietitians who do tend to have more time to talk through where the patient's at and where they might be able to go with food related things. That there's no one size fits all approach. So we want to all, as a healthcare team, be on the same page to an extent of the key messages we're providing to patients. We want to encourage veggies, less sugar, less processed foods, more whole foods whenever possible. And we want to, just try to make sure that they can enjoy their food long term, because that's going to be the most sustainable thing, right? So that's kind of where I have today. Thanks.
You mentioned that we could refer the patients to you.
Yeah, at the VA, I'm outpatient. So we have a lot of different outpatient dietitians that are associated with their primary care clinics. And so anytime you put in an outpatient consult, a dietitian can see them. Yeah.
Thanks. I'll let you talk on the side. Thanks so much, Kelsey, for the amazing discussion. I'll call Dr. Selva, a PhD professor in SIDDHA medicine from India, to give some insights on the work he's doing. Thanks, Dr. Selva. Yes, it's already shared.
So good morning, everybody. I'm going to talk about the holistic primordial preventive methods mentioned in the ancient SIDDHA literature. SIDDHA system of medicine is an ancient medical system of India. It is providing preventive, promotive, curative, and rejuvenative medical system by adapting the scientific approach as well as the holistic approach. So you all well known about the preventive methods mentioned in this conventional treatment methods. So primordial prevention is the prevention of the risk factor. This is called primordial prevention. I would like to share some slides about the primordial prevention mentioned in the holistic medical system. So what is holistic primordial prevention? The prevention of etiological factors and risk factors through the SIDDHA system of medicine approach. It includes lifestyle modification therapy, diet and other food pattern management therapy. The third one is the SIDDHA yoga therapy. So World Health Organization defined as a self-care, the ability of individual or any society to promote health, to prevent disease, to maintain health and the cope up with the illness and prevent mainly the non-communicable challenging diseases to the world. So the primordial prevention methods, according to the SIDDHA system of medicine, there is the daily chores, dinacharya, that is the managing sleep patterns. The early morning waking up is mentioned in the literature as well as in the recent research reports. Yoga exercise, daily practicing of relaxation exercise for all the joints and by doing the yogasanas and drinking water, especially a specific herbal water or specific fermented water is advised. So healthy food pattern and bowel cleansing by using high fiber diet, prebiotic as well as the probiotic diets. So daily bathing is using herbal tooth powder. That is the balancing and promoting the health of the microbiome present in our entire skin. So as much as possible, we avoid the toxic chemical materials present in our toothpaste, soap, and shampoo. So we should avoid the sodium lauryl sulfate, triclosan, nicotine present in our toothpaste. So try to avoid this type of chemical materials for toothbrushing, soap, and shampoo. So transdermal absorption as well as the sublingual absorption of these toxic materials can produce some non-communicable diseases to the world. It affects the immunological system as well as the hormonal system of our body. So we try to drink the fermented rice water mentioned in our system. it is a unique preparation method. The washing and cleaning of the rice and cooking. The cooking rice soaked in the room temperature, soaked overnight, and the next day morning we get the fermented rice for the breakfast, and the water is the drinking water for the whole day. So it contains the essential amino acids and probiotics and essential minerals for it's essential for our system. It enhances the production of the rare vitamin B12 as well as the B6. It is not easy for the vegan and vegetarian diet. So it is ideal drink for the convalescence period. So many recent research reports mentioned that palayasora, that is excessive rice as well as the cold rice fermented waters, is significantly improved the gut microbiome. It is very effectively overcome the irritable bowel syndrome, inflammatory bowel disease, and Crohn's disease. This is an ideal drink for type 2 diabetes mellitus as well as the other non-communicable diseases like hypertension, cardiac diseases, and Alzheimer's disease and dementia. So this is the conscious eating. So how do we eat? How to eat? Enjoy the act of chewing. This is called conscious eating. This is 5 sense organ eating. Chew the food till it becomes liquid. So continuously chewing activate the satiety center in the brain. So it will alleviate obesity and other non-communicable diseases. So how much to eat? 50% fill with the solid food, 25% fill with the liquids like buttermilk, soup, and water, and some other fruit juices. 25% keep empty. So how many times to eat? Eat once a day, become yogi. I think David is a yogi present here. So the healthy persons eats twice a day, eats thrice a day, become rogi. This is the diseased conditions. Thrice a day eating is will lead to rogi, diseased conditions. Those who eats more than thrice a day become palarogi. It means multimorbidity. This condition is called in SIDDHA system as a palarogi. There is a there is more than 2 or 3 non-communicable as well as the communicable diseases present in.
Call that as drohi.
Drohi, yes.
It means you are what else?
Yes. Okay. We will finish in a few minutes, but the time is very short. So fasting therapy is very useful for many conditions. I think Dr. Anand Chokkalingam is working on this fasting. He is reversing some cardiac diseases, the endothelial damages and arteriosclerosis by fasting therapy. Many documents are available in a website. So weekly once oil bath is essential for overcoming many non-communicable diseases. It removes the excessive heat from our body, and it prevents premature graying, and it improves the skin health and eye vision. It regulates the autonomic nervous system and normalizes the blood pressure, sleep, digestion, and improves the concentration and memory. So it believes that removes the free radicals from our system. So by removal of the free radicals from our system, it prevents the arthritis, cardiac disease, and some other diseases. And it ultimately will lead to preventing the aging. So periodical bowel cleansing method is the unique method mentioned in our system. So the combination of castor oil, ginger juice, and honey, that is 5 to 8 years, we need to mix 1 teaspoon each. That is a castor oil 1 teaspoon, ginger juice 1 teaspoon, and honey 1 teaspoon. Give it in the early morning. On the whole day, you will get the diarrhea and vomiting. So the complete bowel evacuation and the complete emptying of the stomach. And after that evacuation, periodical bowel cleansing, we need to give some buttermilk or curd on that particular day to reinstate the gut microbiome. So the bowel cleansing method is essential once in 4 months for alleviating and managing, preventing many diseases. So these are all some natural homemade preparations for the prevention of many diseases. First one is the spicy powder. There is a combination of curry leaf, dried ginger, thymol. There is a carom seeds, asafoetida, cumin seed, pepper, and fennel seed. This combination is effectively overcome to neutralizing the bioenergetic principles of our body, as well as it prevents many GI tract related disorders. The other ingredients are also very useful for the primordial prevention method. So many recent researchers using the Indian groceries, Indian kitchen made preparations, especially the sampar is a liquid. It prevents the colon cancer, is reported by the recent researcher. So sleep is very important. For younger adults, 7 to 9 hours of sleep is must. So another important point is stop using electronic instruments like mobile phone, electronic screens like a tablet, a laptop, other items. Completely close all the using all this electronic instrument at least 90 minutes prior to the sleep. It is very, very important for preventing many diseases. Many Siddha postures are mentioned in the literature. Tirumular Tirumandaram, this is one of the ancient Siddha literature. These asanas improves the quality of our body, mind, and soul. So this another set of compilation of asanas, that is the Nyayiru Vanakam. Sun salutation is also useful for preventing many diseases. Abdominal breathing, that is otherwise called conscious breathing, diaphragmatic breathing, or belly breathing, is a very useful breathing method. Inhalation and exhalation in a specific timing, and we are focusing on the inhalation and exhalation. By using this technique, we are controlling many diseases. Okay. So another thing is alternate nostril breathing. So alternate nostril breathing with the specific gesture of a hand is effectively overcome many diseases, especially hypertension and some cardiac diseases. Obesity will overcome by this alternate nostril practices. So Varma therapy, this is unique therapy of Siddha system of medicine. By stimulating energy points of our body, by preventing and curing many diseases. So more than 130 classical literatures are available in our India. This is usefulness of Varma therapy is managing and preventing many diseases. So these are all some traditional ethnic sports and folk dances of India. This physical activity, integrating by this physical activity and the dances, is preventing many diseases. This is the important part of our ancient India. So music therapy, by listening music, singing music, by using the instruments is also a part of primordial prevention. And pet therapy and garden therapy is also a part of primordial prevention methods. So by using this holistic primordial preventive methods, we prevent the risk factors of the dreadful diseases of the modern world. So we need to integrate this primordial preventive methods in the mainstream medical system for controlling as well as preventing the many challenging diseases. Thank you so much.
Amazing discussion. Thanks so much, Dr. Selva. I invite Dr. Arul Amudan from Manipal University to come and give some insights. Because we are running short on time, we're going to request everyone to be very brief in their presentation.
So good morning to everyone. I thank Dr. Anand Chokalingam for arranging this wonderful meeting. So if the question is asked, how long you want to live? Nobody want to die. So everybody want to live everlasting. So currently medical field is thinking about anti-aging. So death is unavoidable, but at least until the death, one should be a healthy. So that is what anti-aging. Even whether the concept of anti-aging is a recent one or is it mentioned in the ancient days, if you look at the literature, last 15 to 20 years, the scientists are talking about regeneration, stem cell therapy, anti-aging. But the traditional Siddha medicine has an insight on the anti-aging because they said the body, human body is the temple where the God resides. So the body or the temple has to be preserved. So they developed the traditional Siddha medicine and yoga practices to preserve the body. So there is where the anti-aging therapy concept arose. So they are asking a question whether a medical system, if it cures the physical disease, is it a complete medical system? No. If it cures the mental disease, then also it's not a complete medical system. If the medical system can prevent the disease, then also it's not a complete medical system. A medical system should delay the death process. I mean, give the anti-aging effect, healthy aging effect. So keeping in mind these four objectives, our ancient Indian yogis, they are called Siddhas, developed the traditional Siddha medicine. So they have given a name for anti-aging therapy, Kaya Karpam. It is a special branch of traditional Siddha medicine that deals with anti-aging therapies. It includes many herbo-mineral drug therapies, herbal supplements, dietary practices, lifestyle practices, yoga, pranayama, meditation practices. We have more than 50 classical literatures to deal the anti-aging therapeutics of traditional Siddha medicine. 108 herbs and herbo-mineral supplements are listed, and a few things we are using even now also clinically. So Kaya Karpam therapy involves in DNA repair process, endogenous utilization of stem cells. So this is another important concept described in traditional literature. Currently, the stem cell technology is done in the in vitro lab-based stem cell after differentiating to the expected neuron or heart cell, whichever we need, then it is reintroduced into the body. But ancient Siddhas, they developed the technique, that's a Kaya Kalpam technique, therapeutic, the whole protocol. Through that, one can utilize one can endogenously utilize the stem cell. So that is the special technique that offer the healthy longevity. So I will be just showing two herbs in that many researchers have done to give the anti-aging effect. And there are organ specific anti-aging herbs, like for example, Embolica officinalis, Amla is for the heart, Candela asiatica, Vallara is for the neuron, Eplicta prostata is for the liver. So like that, we have the organ specific anti-aging herbs. So first, Indian gooseberry, that's Embolica officinalis. So Embolica officinalis based the Kaya Kalpa recipe, that's Nellikai Rasayanam or Amlaki Rasayana. It is used by many Vaidyas and yogis. So there are studies. They have done a study in the Drosophila. The lifespan is actually few days, 3 to 5 days. After administering this particular Amlaki Rasayana, the lifespan was increased. This was the first path-breaking study, demonstrated the existence of anti-aging therapy in Indian traditional medicine. This is another important study. This is the clinical study performed in my university, where other researchers are involved in the anti-aging research. There they had categorized the old age people into two groups, placebo and the Amlaki Rasayana group, and the drug was administered for 45 days. After 45 days, the peripheral blood mononuclear cell was collected, and there they have done the UV radiation induced DNA strand break repair mechanism, how it withstand. And they observed that the treatment, the anti-aging treatment in the aged individuals showed the stability in the maintenance of DNA strand break repair without toxic effects when compared to placebos. This is one of the proposed mechanism, and this again give the confidence. Yes, the anti-aging therapy Kaya Karpa mentioned in traditional literature is true. And following that, there are many other studies. Even they have done the same drug on the telomerase activity. It again giving the supportive, encouraging results. And another same Amlaki Rasayanam was done in the, but it's a preclinical study done in the animal called left ventricular failure animal model. And it showed the improvement in the, aging, improvement in the fatigue time, and decreased the left ventricular failure compared to the other placebo group. And this is again giving encouragement that traditionally it is mentioned for the heart regeneration. And further studies are now it's done going on in my university. So, and people may slowly working on neuronal and other systems. Another herb is Sandella asiatica. So this is again very important in Siddha medicine. So there are many studies that demonstrated the ability of the Sandella asiatica in the regeneration of the central nervous system, as well as in the peripheral nervous system. And in this study, even the researchers incorporating Sandella asiatica herb extract in the stem cell technology. So in the stem cell, mesenchymal stem cell in vitro itself, they added the extract and they found it is actually improving the cell peripheral regeneration. So because of time constraint, I am finishing my talk here. What I would like to say is there is a huge potential and scope for research in the Kaya Karpam therapy for anti-aging. Thank you very much.
Amazing. Thanks so much, Dr. Arul. We'll have the questions after this. I have Amy joining us. I'm trying to see how to give her the host. Thanks so much, Dr. Arul. Next, I invite Amy to introduce herself and present her slides.
Good morning. Now I need
Are you
to
able
figure
to
out
join
how to, can you hear me?
Yes.
Okay, very good. Now I just need to figure out how to share my screen. And it would be the correct.
Green button. Perfect. We see your slides fine. Excellent.
Okay.
Thanks so much.
All right.
Keep it very short because the audience, they take the ACUF at 12. So thank you.
Sure. Okay, so let me get right to it. So I appreciate the opportunity to share the, I see that I'm sharing the wrong slide, but I'll get to it. It'll be fine. So the cardiovascular service line is bringing a new program to our cardiac rehab called Intensive Cardiac Rehab. And Pritikin is the corporation or organization that we have partnered with that is a CMS approved supplier of intensive cardiac rehab. And so one of the reasons, right, what is really intensive cardiac rehab? And it really takes that natural progression of traditional cardiac rehab and adds a more robust nutritional aspect to it, as well as a healthy mindset aspect for our patients. Many of these patients that have gone through cardiovascular events, we really need to think about their healthy mindset, just given the fact that they have never really had any kind of cardiac issues potentially before. So again, traditional cardiac rehab has really been focused on exercise, a small amount of education, but this really takes into consideration the nutritional and healthy mindset aspects. So again, Pritikin is the partner that we are looking to promote this program with, really because it's comprehensive. It's definitely scientific based or evidence based platform, as well as Medicare approved. So there's really, again, kind of that three-pronged aspect in the fact that it's good for our patients. Physicians look at it from a positive outcomes perspective for our patients, and it is positive from an organizational financial perspective as well. So how do we get this enhanced education and all the nutritional components to our patients? So traditionally 36 sessions, which have been mostly exercise driven, is traditional cardiac rehab. This actually doubles those sessions so that we get the educational pieces around the nutrition and the healthy mindset for those patients. So I'm hoping that this video will work, because this really speaks to why we want to choose intensive cardiac rehab.
Amy, we're not hearing the sound.
Amy, people may view it later if you want to go on, because we are not able to hear the sound, and it's also getting short on time.
Hey, Amy, we can't hear the sound on that.
Can you hear us, Amy? Amy, can you go on to the next slide, please?
Okay, so really the biggest
Because
point
we're
about
not able
this-
to see the video, I mean the audio. So if you move forward, that'll be great. Thank you.
So sorry. That's the disadvantages of sometimes doing virtual, right? So the biggest piece of that is patients are engaged in this program. We've seen where I implemented this before, we have seen great strides, not only in patients seeing their blood pressure medications drop, potentially coming off cholesterol medications, improvements in all of those components, but also a component that you don't typically see in regular cardiac rehab is weight loss. And so again, this really does speak to all of the components that are important that each of you have probably spoken about today related to cardiovascular issues and the improvements that you can see with programs like this. So we are very fortunate to be ready to almost launch this in our phase 1 in our current space in the lower level of the facility. And so appreciate any questions, or if anybody needs anything after the fact, please don't hesitate to reach out.
I think this is really going to be a big help to our community. Thanks so much for the initiative, Amy. Thanks for sharing your information.
Sure.
Next, I'm going to invite my dad, Professor Chokalingam, to tell us about the connection between the mind and the heart and why it is so important for heart health. Thanks so much, Dad, for joining us from India. Let me see how to share the slides. Yes. So again, are you able to see the slides full screen?
Dear friends, I'm delighted to be here and share my concepts just for a few minutes. Today, I'm completing 55 years in cardiology, getting to 56th year. I'm standing before you. I'm really very proud and privileged. What is ultimate wealth is, no doubt your health is. That's the reason we call it as health is wealth, no two opinion. And they defined health, first they thought is a disease-free state. WHO redefined health about 40 years before. I was a part of that when they're redefining, that is, health is defined as positive state of health, physically, mentally, physically, spiritually, and socially. We call it as holistic. Then we thought combining that mind, body, soul, we're going to combine both, all the three, we call it as yoga or meditation. So ease is natural when you are born. Unfortunately, when you become intelligent, you are dispelling the ease, then the disease comes. So a disease is invented by you, not given by anyone else. That is what we call mind-body disease. We call it as psychosomatic by Latin. So body and soul cannot be separated. Both are controlled by your positive mind. The moment you become negative mind, the same mind will destroy you. It all depends what is your attitude is. So mind is, which we cannot see, it cannot be touched, but it is operating only in the brain. Please remember, even the brain is activated or controlled by your unseen mind only. And not only the brain, the heart and all organs are controlled by your mind. Mind is nothing but the sensory organs that sense the feelings of the brain, and then it converts into thoughts. Then you become intelligent. If you're going to have sixth one, we call it as human being. Fifth one, senses, animals. Once you get the mind, please keep the mind 360 degrees open and keep it as open parachute. And the mind decides the personalities of A, B to E. So when you're going to say how many brain cells in an adult, please remember there are 100 billion cells. Out of that, you're using only 7% for your existence. Anything less than 4, you have to be admitted in mental hospital. If you get 10, you'll get Nobel Prize. So by means of your intellect, it must control your mind. Mind must control your body. Then only the precious life will be preserved. So the self-realization is a SIDDHA, Jnanam, wisdom. Once you are going to sit and realize what you are, nothing in the earth will affect you. Once you are at self-realized state, then only get the peace of mind, then only the happiness will come, and the happiness hormones will secreted by neurotransmitters, and they'll make you healthy. As you are saying, our friend, even now looking at 20 years now, it all depends upon realization. Control of happiness, unfortunately, they give it to others to control you. Please keep it within you, that happiness. How are we going to be serene to accept the things we cannot change? Courage to change the things we can. Wisdom is to know the difference. If you fail in that, so energy you consider is the life, soul, or God, whatever the name. So energy, what it needs is the energy for it to work, you need the body. That's what. So the energy body, as long it is going to be intact, it will work for more than. How the evolution theory, I don't want to say, but our ancestors are living, they've been having the fight, flight hormones of adrenaline. And without that, we would have been no more like all dinosaurs. Our ancestors made it to live your year after millions of years later. But unfortunately, see how this person has become. More so how this person is. These two persons are only making us to become more active and busy. So stress is the reaction of body and mind. It is not possible without the stress. I always tell them, be at stress, but be positive. Thereby endorphin or hormones will be secreted. But the moment if you go to negative one, it will increase the adrenaline and it will kill you. So it is a mind that is going to make you either positive or negative, your attitude. So be positive and be calm. And meditation, all the time when you are sitting, please sit straight like that. When you are going to sit straight, you live longer. A negative personality, A is avaricious, C is a compressed, D is distressed. I introduced 20 years back type P, it has been accepted. Type P is an exchanging personality. All the four should be avoided. So the 3 killer diseases, please remember, heart attack, cancer, and accidents. All are lifestyle diseases. Once it is hit today, all the 3 can be prevented 100%. The same thing, COVID can be prevented. Please remember, the suicide, unfortunately. All the diseases what you can enumerate are all starting with the mind, including all the things what I said. You know, the heart beats 72 per day. It meets 100,000 times one, and then size, weight, and everything. Please remember, length of the blood vessels in the body is 100,000 kilometer in a 6 feet person. And please remember, there are 40 trillion cells in our body. Each cell is an individual organism. For all the things to work, and the heart to work more than 100 years, be at peace and happy. So you know that heart attack is a clotting of the blood vessel. It results in the heart attack. The negative stress is the one I want everyone to focus. The moment you are going to be a negative personality, tend to take more food, you become obese, you become sedentary, and you will start smoking things that it gives the happiness. And because of the cycle goes, please remember, the cholesterol increases, sugar comes, and hypertension. All the things are invited diseases because of the cycle. And by that way, it produces infarction. Please remember, your children are closely watching. They will try to travel with this cycle. Please remember, all cholesterols are mandated in the blood as long as it is a blood. Remove the cholesterol, heart and lung, brain, all the organs will stop. All the organs are functioning. All elements of cholesterol as long as it is in the blood. But unfortunately, chronic negative stress, please remember that cholesterol get deposited in the blood vessels. Thereby, it produces all changes. And two, it may produce clotting of the blood vessels, acute stress, or narrowing of the spasm. So obstruction, clotting, and narrowing, all three are contributing. So Indians are more prone for heart attack, and you know that as a slide shows. The maximum heart attack comes in the morning, 5 a.m. to 8 a.m. Can you guess what day it is maximum it will be? What day of the week? Maximum heart attack? Monday. Maybe a good experience he is telling is a true. Good. So heart attack, you know that various symptoms, first 6 hours, you call it as a golden hour. And you know all the investigations, and you can do even emergency stenting, pacing, everything. And now the day is not far off to have all lungs, heart, kidney, brain, and everything can be manufactured as a artificial one. Please, everything is only temporary. And best degree to have it among all is a be calm. Not the degree I mean, be calm in your attitude. So 3 mantras, please follow this from today. Be positive in thinking, be healthy in eating, and be adequate in exercising. It's reversed one in the slide, doesn't matter. The thinking, eating, exercise, the 3 E's are very, very important. So the positive cycle, how it helps. Once they are in positive attitude, they will like to take only vegetables and fruits. They're very active all the time. They keep the weight optimum. They will stop smoking and they will go near the smoking. And when the cycle continues, please remember, within 6 months, cholesterol becomes normal. After 1 year, they don't need to take sugar medicine or hypertension. Thereby, you will get a permanent cure of dissolving this reversion of obstruction. And children will try to follow this cycle, what you have been doing that. Very important slide I want to say. It has been proven about 18 years back. Now it's more the last 7 years. Any obstruction, please remember, if you follow the lifestyle of what I'm saying, the life cycle, the endorphin and melatonin and STL, please remember, after 1 year, it reverses totally. So don't think it's a permanent thing, it's a one. Another important news I would like to give to our August audience is, if they are born with the diabetes, or parents, grandparents given to you, and you are given the diabetes, hypertension, cancer, of all the genes to your children, without knowing, without any. But please remember, it has been now invented 4 years ago. It has been published 3 years ago in San Francisco, where I addressed 18,000 people, where if you are going to follow the lifestyle positivity from today for 9 years, how many years? 9 years, the genes get mutated to positivity. So genetic mutation is possible by means of, because there are epigenes or phenotypes. So success is not the happiness. Please remember, happiness is the greatest success. So all the happy hormones can be produced. Happiness only will secrete happy hormones. Once they are secreted, it will make you more happy as a vicious cycle. So please remember, then if you're going to have endorphin extracted, it can be given only injection, but tons is endorphin costing 200,000 rupees, but it can give work only for 10 minutes. The moment if you stop worrying and keep smiling as madam is doing that, you are constantly secreting endorphin more than 100 years. Good. So type B is like that. Once you have been doing meditation, there is no need for any medication at all in question of time. So that calmness mind reduces the sympathetic, thereby negative hormones, increases parasympathetic, thereby positive hormones. So if you're going to see, what is the thing you are seeing, doctor? What do you see in the slide? Yes? Very good. So you are not bothered about the black spot. That's the reason why she is smiling. So don't worry about that. I appreciate the excellent answer. One generation means how many years? If you know your date of birth, your first child birth, the gap between the two is one generation. What you now gain, it must be communicated to generations to come. So ease is a way of life. It is not the race. And as the ship goes in that one, it can travel in the problem of sea. But once the whole forms, the ship shrunk, how it is. So it never comes to a job is the one. Money is important. Don't get worried about earning money. After one, you add any number of zeros, but adding zeros, the value of that zeros only if you are healthy, number one, your life is. So work is worship and work and balance. You must sleep minimum for 7 hours. This position is optimum. Sleep and happiness like butterfly. If you try to catch, it will run off. If you're going to sit, you must come and sit. Nuts all are good. Zero cholesterol and all nuts. Please remember. Food tips, they already said how they must, and they all explained that one. Breakfast, lunch, dinner, very, very less, and water is very important. And please remember, better to fast than to live on fast food. When the TV invented, how it was very thick, and how the person who has been watching the TV was very lean. Now see here, the TV has become very slim. The person who was watching has become very obese, and that should be once again go back. So active smoking, passive smoking, lift is mandatory for everyone. Otherwise, no. And all that exercises will prevent most of the cancers too. So please avoid hurry, worry, curry to get buried. So he wants more till no more. Everything fast, life ends faster. And between the two, the line is the life. You can extend it, reduce it. It is only in your hand. So keep smiling as Anand has been telling, and there won't be any disease at all. And life is a rainbow. It will come and go off as we are. And we cannot touch and see the rainbow nearer. See your life from a distance and take the vegetables, fruits, and all the colors in the rainbow. It's very good for you. Make that aerobic exercise and meditation mandatory. If you don't listen, then also you'll have like rainbow, but rainbow of colors and medicines which you want. And you always plan to live without medicines. So keys to be happy only in your fingertips. Control yourself. Alternate if necessary. Delete the unwanted things. You are left only with happiness. Life is a calculation. Add good things, deduct minus bad things, multiply knowledge, divide your time, and live in balance. You ought to live for 100 years. So yesterday is a broken pot. Tomorrow is a cat on the wall. Today is the what is a musical instrument. Live in present. All the time when you look at the time, you must look at now only. Live in now is the most important thing enough. And please get up for a second, and every one of you standing here, and give a big hand to Anand and all associates, those who are given that. Why I'm saying that you must give a big hand of appreciation is because they're doing an excellent job for the society. I really appreciate. And thank you very much. All the things are there. I appreciate once again every one of you for the patience listening. Thank you.
Thanks so much, Dad, for joining us and giving us an overview of health and wellness. Appreciate your time. Thanks, everyone. Any quick questions? Marilyn, do you have a question for Dad?
Well, I
Go on.
not a question, but it was so great to hear your presentation. And I loved it.
Thank you.
Loved it.
Excellent. And another point I want to say about the food wastage. what Anand and everyone is telling, taking 1 meal a day, there won't be any wastage at all. That way you are adding to the society. Thank you very much, Kiruba.
The patient really listened, enjoyed all the speeches. That's really awesome.
And who is giving the voice is Anand's mother, Dr. Changavari.